Next lecture is going to be done by Dr. Tarsia. He's a vascular neurologist here at Ochsner, but soon to be cognitive neurologist as well, a cognitive vascular neurologist, even rarer than a behavioral neurologist. Dr. Tarsia has been instrumental in our program's growth over the last 2 years, focused historically on cerebrovascular disease, but over the last 2 years has built one of the largest cerebral amyloid angiopathy cohorts in the world. We're the largest enroller on the Capricorn trial, the largest cerebral amyloid angiopathy treatment trial in the world. And today he's going to be talking to us about this condition, what it means, how it parallels Alzheimer's, its individual features. Dr. Tarsia?
All right. Thank you. So before we get started, I need to know if any of my jokes are going to land. Who here is an Orleans parishioner? Oh, this might not work. Okay, all right. Who here has connections to the Sewage and Water Board? Or the Department of Public Works? Nobody? Okay, good. So we're going to talk about vascular contributions to cognitive impairment and dementia. I know it sounds like a mouthful, but that's actually the term shortened to VCID. So we'll learn what vascular contributions to cognitive impairment actually means. We'll learn about microvascular disease, and we'll talk about some risk factor modifications that you could potentially do to change the course. So the global burden of dementia, as we know, is continuing to climb. There's no secret there. And the projections by 2050 are quite dismal, actually. If we look at all causes for dementia or cognitive impairment, we can see vascular disease, and we'll talk about what that actually means, is a pure cause in about 1/5 of cases, so 20% of cases. There is a large majority of patients, even those with Alzheimer's, dementia with Lewy bodies, et cetera, where the blood vessels are playing a role. So blood vasculature, brain vasculature is a diffuse process. And we're going to learn how it's not just about the strokes that are causing the problems. So traditionally, we thought of vascular dementia in medical school. A vascular dementia was the only dementia that happened overnight. You had a big stroke in a really important area. Think of the game Battleship, right? You have a stroke or a brain hemorrhage, something ruptures. Suddenly somebody who's walking and talking and doing things normally immediately overnight or within a couple of minutes, those things are taken away. We think of dementia and cognitive impairment as a slow, pervasive process. But actually what we've come to know in the last couple of years is that vascular dementia actually is a slow and pervasive process. The actual battleship effect is not the majority of patients we see. In fact, vascular cognitive impairment comes from a slow, insidious process, things that are building up over time. And we're going to learn about how the blood vessels become destroyed during this process, what's causing that issue, and what these patients actually tend to look like. So silent microvascular disease, I don't know if anybody here has had an MRI or a CAT scan where on the report the radiologist said silent chronic microvascular disease. It's actually really common. In fact, when a patient comes to my clinic and their brain scan shows nothing at all, we have a second line because it's almost impossible by the time we hit our 70s and 80s that our brain is completely clear of problems. And we're talking about blood vessels that are the size of the edge of a pencil tip. Okay, and even smaller than that. What I wanted to do today is not drown you guys in the science, but to unpack a few of these markers that we typically see on scans that radiologists are going to call chronic microvascular disease. And so when your doctor shows you them, you're a little bit more familiar. So the first one is white matter hyperintensities. I think of these as boil water advisories. These are areas of the brain that are susceptible to low flow. We've all been in the shower during a boil water advisory. I guess only those who are in Orleans Parish. And there are certain regions, just like New Orleans East, that are always in a boil water advisory. There's always a low flow state. So you can think of these regions of the brain that are susceptible to chronic microvascular damage. It's usually the core center of the brain because the brain is perfused from the outside in. So it's the longest path for blood to flow to get to these regions. Lacunar infarcts are silent, covert infarcts. How many patients come to clinic and say, I got this report, and this is not me. They said I have 3 strokes. I've never had a stroke. The truth is you have. And there are plenty of people walking around that have had strokes in their brain that they did not know about. It's very common, even in the 40s and 50s, especially as we get older. Again, if you're not from Orleans Parish, you might not get these references. What I did find really great was this joke on the bottom here. I don't know if you can tell, but in regular cities, you can tell sobriety by driving straight. This is going to have a neurological correlation, I promise. In New Orleans, a test of sobriety is if somebody can actually maneuver around the cones, the obstacles, and the potholes. It's a very different thing. But then I got to thinking that, think of the amount of energy that your brain expends trying to maneuver around those obstacles. So as these things start to build up, your brain has to spend extra time doing extra things, figuring out how to meander the connections around all of these problems. So it's the beginning to start to understand how cognitive impairment, slow pinpricks over the time, cause these issues. And lastly, I find the most interesting, maybe not the microhemorrhages, but the actual water flurries that we see. These are areas of the brain, they're in dark black, where the blood vessels are damaged and they're leaking out fluid, they're leaking out blood. And this will never go away. There's stains forever, kind of like water stains on the ceiling. And this is blood vessel integrity. So these things that we see in the street, I always wonder, there's actually something going on right now in front of the Sewage and Water Board tower that's been geysering for 3 months now, 2 months. I always wonder, like, if I go over and stop my car and put my foot on top of that, like, are all the manholes in the city going to explode? Like, maybe it's purposely done there. I mean, it's right in front of them, but okay. So the numbers here are staggering, pretty high, people walking around with this brain injury. But I want to transition to talk a little bit about the networks we've been talking about and how these little silent injuries can build up. So this takes place over time. One little tiny stroke, one little white matter injury, one little bleed. Over time, we know that the brain, the old thought was this part of the brain does this and that part of the brain does that. But now we know that it's a lot more connected. One part of the brain needs to talk to 2 or 3 other parts of the brain before a function is done. And if you were disconnecting the connection tracks, all those little spots we saw kind of lie in the telephone pole connection areas. Think of it almost like a Pinocchio on strings, right? Even just one movement is going to require different strings to be attached. And so we start cutting all these strings and we start seeing a very specific type of presentation. And we have been able to see thus far all the different types of brain injury, but what we can tell actually before these things build up, using fancy MRI techniques like DTI, diffusion tensor imaging, we can tell all of these connections, all of these pathways in the brain that are severed from each other well before they start to show up on an MRI machine. And this connection is important because the way vascular disease affects these connections is a little bit different than other diseases. And so a vascular cognitive impairment patient will have a few more specific types of findings. They'll have mood disorders, which isn't very specific to vascular cognitive impairment, but we see vascular Parkinsonism, a magnetic gait where feet don't leave the ground and they shuffle. We see dysautonomia and sleep dysfunction and the connections, again, towards the urinary centers. So we see a lot of urinary incontinence, behavioral changes, and profound apathy, something that is mislabeled as, oh, all of a sudden he's becoming just lazy. He doesn't want to do anything. He doesn't want to get off the couch. He just sits there and doesn't do much. These are actually part of what we call executive dysfunction, which is getting from part A to B to C. And some people are just stalled in these areas. So these are some of the findings that the specific networks that are challenged in vascular cognitive impairment might manifest in you or your loved one. So I'm going to shift gears just a tiny bit and talk about what's happening at the cellular level or at the way end of the tree of the vasculature. The blood vessels in the brain work together in a unit. Think of like a special ops unit. There's a very intricate balance between supply and demand. As I'm talking to you right now, I'm moving around and doing things, there are regions of my brain that are lighting up and saying, I need more fuel. The way that happens is there's a delicate balance. Those neurons are directly connected to the blood vessels, telling them I need more fuel. And the blood vessels, if they're healthy, they will dilate. They will shunt more blood flow to certain regions that are active. And if they're not healthy, they won't. They also constrict in a healthy fashion. In case the blood pressure goes up super high, you get super excited, you're nervous, you have to give a talk. Your blood vessels are going to constrict and protect your brain. And so there's this delicate balance that is really important. And when we see this breakdown is when we start to have problems. The other major function is how it clears the brain. Now, we've had several awesome talks today about sleeping, deep sleep, clearing out the brain, the lymphatic system. Well, the drivers of the lymphatic system are the blood vessels, the microvasculature, the arteries, the veins. Our brains are bathed in cerebrospinal fluid. We think of when we've all had lumbar punctures, we take the fluid out, but that fluid connects all the way up to the brain, and our brain is just floating there. And that's actually how we bathe the brain and how we filter out the brain. So in order for this to happen, that spinal fluid has to enter the brain, enter through the arteries, the spaces around them, and exile through the veins. And there's actually a really intricate system. So I gave amyloid beta as an example. Amyloid beta is what builds up in CAA and what builds up in Alzheimer's disease. So the arteries are actually pumping blood towards the brain, and within the wall of the blood vessel itself, because there's pulsations of those muscle cells in a healthy state, they're actually pumping waste products in the other direction. So it's really delicate, and it's really important, and it really requires healthy arteries and veins. I'm not sure how many of you are going to get this reference. Game of Thrones? No? Yes? Okay. The blood-brain barrier is vital to keeping blood where it belongs. The blood-brain barrier is a fancy term that we use to say how well do your blood vessels connect to one another and how leaky, we just talked about gut leakiness, how leaky are your blood vessels? And when we start to destroy them, we start to get leakage of toxins. We get the White Walkers that cross south of the wall, for those of you who are into Game of Thrones. So we can see the blood vessels are playing a really, really important role in some of the most important functions of keeping the brain healthy, even in things like Alzheimer's and other proteinopathies that we learned about earlier today. So what can we do about it? So every couple of years, the Lancet Commission publishes a paper about all the risk factors that we think contribute to dementia cause across the world. And imagine the fact that 6 or 7 of them are actually vascular related. Now, all of these factors, all 14, contribute to approximately 45%, attributable fraction of the world's dementia. But a majority, or at least 50%, sorry, are vascular in origin. The 14 are there on the right-hand column for dementia, but look how they overlap. They overlap with Alzheimer's disease specifically. They overlap with the causes of stroke, and they overlap with small vessel disease. For years, we said, oh, Alzheimer's disease, high blood pressure, diabetes, all these things increase the risk of Alzheimer's disease. But the connection is the blood vessels, right? That's what's happening. We need healthy blood vessels. And we think that if we actually do our job to control these risk factors, we can actually reduce the amount of dementia cases substantially over the next couple of decades. So the American Heart Association has put together this Life's Essential 8. Now, this is not just only cognitive impairment. This is stroke reduction risk. These are the things we've been talking about today. There's nothing special here. If you go to the American Heart Association, you can pull up PDFs and pamphlets of each one of these, and I promise you it will mirror everything we've discussed. We're going to dive into blood pressure because that's my favorite. But optimization of healthy sleep, brain clearance, eliminate smoking, prioritize physical activity. When we exercise, we release exerkines and stimulate different parts of the brain and different parts of the blood vessels, especially that endothelium, to protect the blood-brain barrier. Controlling glucose. If you're pre-diabetic or diabetic, there is no greater control that will make a difference in your life than getting your diabetes under control. Management of cholesterol, healthy weight, and eating a mind diet. Combination of the DASH and the Mediterranean. We've talked all about that today. We've eaten it today. We've lived it today. So I'm going to dive in on one of my, I don't know how I feel about this as a pet peeve of mine or at least a struggle. When we started the cerebral amyloid angiopathy clinic 2 years ago, more or less, I really wanted to make a campaign about blood pressure. And what I've noticed over the last couple of years, and I've been surrounded with an amazing team. And I can't think of anybody else, other teams that are putting as much effort and energy into blood pressure control as we are, and we are coming up against a lot of battles. The knowledge of what is normal, and I don't know if this is just, again, a New Orleans or regional thing, more people call me with a blood pressure of 110 without symptoms, panicking that their blood pressure is low, than the people who sit in the 140s, 50s, and 60s for 3 decades. They never call me. It's wild. And so we've done our best to increase education, to get the point across that 130 is not normal. 140 is not normal. And it's not just the patient's fault. It's the provider's fault. It's all of our faults. And it's actually the people who make the guidelines. Because if you go back a decade, there was a push to say elderly patients should be 150 or less. Don't drop them too low, they'll pass out and they'll fall and they'll hurt themselves, which there is an element of that, but that's where the guidelines were. So things are swinging in many directions, but recently they're swinging in the direction of more aggressive control. So we do a lot to educate. We actually give our patients these handouts so they can see visually, and I think this is getting across. We actually implemented this page in our handouts about 2 months ago, and it's been really helpful. We give them a sheet to tell them how to check your blood pressure and what to do about it. And we give them monitoring devices to do that. Well, not the devices themselves, but tracking sheets. Monitoring devices are coming. I hope to get that. So what happens, I know we're working a little bit backwards here, but what is happening to the arteries with blood pressure? So imagine, the best way to give this analogy is you're going down the highway at a normal speed. You should normally be able to get off the off-ramp. The off-ramp is your small vessel. The highway is the large artery. And if you're driving at a normal pace, you should be able to get off the off-ramp. But if you're going way too fast, if your pressure is way too high, you're not getting off the off-ramp slow enough, you're hitting the guardrail over and over again. Now in a normal city, they replace the guardrail. They make it stronger. They reinforce it. And that's what your blood vessels are doing. They're getting stronger. They're reinforcing. But it only works for so long. They're actually putting collagen inside of themselves, like the collagen we have in our knees and our bones, in our joints. And so eventually these things become constricted, they block off, they block flow, they cause strokes, microvascular strokes, they cause little aneurysms that you can't see, and they rupture and cause a hemorrhagic stroke. So I wanted to at least show you guys without going crazy with the science, but that's what happens to these vessels. Now there's hundreds of causes for microvascular disease, but this is where we need to focus because this is the most common. And just like there's many causes of dementia and vascular causes can contribute to all of them, if somebody has, for example, cerebral amyloid angiopathy, any blood pressure problems, this is going to be an instigator in making it worse. So this is the baseline. This is what we need to address regardless. And these are the most easily modifiable. There was a Sprint Mind trial that happened not too long ago, which showed that if we control patients, now look at these two groups, 140 to 120, that's not what we consider very high. And the 120 group, less than 120, that's normal. Like who thought to have a blood pressure trial, normal blood pressure versus less than 140 to 130? We're not talking 170, 180. And what they found was we dropped the risk of MCI, mild cognitive impairment, we dropped the risk of dementia, we reduced the amount of white matter changes from group to group. The group with the more control had less white matter change than the one that had a more lenient control. And the best part about this is that this was a durable effect. So they controlled them for 3.5 years. The trial was positive. That's great. And then they just let them do what they wanted to do and then checked 7 years out. The effect was still there, even if they controlled it for those 3.5 years. And beyond getting things to control, I would agree that there are lots of people out there that will never get to 120. We'll never get to 110. If anybody in the audience has struggled with blood pressure, sometimes it's just not easy. And they can cause side effects, and they can cause dizziness. And this trial actually showed that for every 500 people treated, there was some lightheadedness and dizziness and syncope. And when you come to my clinic, we check you for orthostatic hypotension. Everybody who comes in gets sitting and standing, blood pressures. We try to screen for that before we sit down and tell you, hey, this is where we want your blood pressure to be. We try to make sure what your history was, what you've taken, and we want to make sure that we're not going to cause harm. No, we don't want anybody to fall, of course. Now, the American Heart Association kind of just published brand new guidelines in 2025, and they didn't adopt less than 120. What they said was we highly encourage less than 120, but we want you less than 130. Again, wavering. They'll tell you, as in the previous slide, that normal is less than 120, but we want you below 130. Interesting. So for our cerebral amyloid patients who have all those micro hemorrhages, we try to get their blood pressures less than 120 if we can. And this is one of the last slides. I think we've talked a lot today about how exercise, sleep, and the mind diet can help your blood vessels. So I won't go on about that. And we'll summarize this into a few bullet points. Disease is a major contributor to worldwide rates of cognitive impairment. Microvascular disease is a silent epidemic. And unlike many other untreatable causes, we can maybe do something about it if we control all those vascular risk factors. Okay, thank you.
Thank you, Dr. Tarsia. Portrait. Of course, everything's AI.